clinical data, or you have done enough research, or if there are similar devices in the market, you have gained enough data from existing devices also in the market, and you are evaluating those in the right way, right? So the whole emphasis on clinical data, and when I use the word clinical data, I'm not talking about you creating your own clinical study and creating your own data. Not just that, I'm actually talking about in general clinical data with respect to your device or your type of device, right? So it can be your own data through the clinical studies that you are doing, or it can be your competitors' data or predicates data that you are looking at, right? So that emphasis has gone very high, right? And they keep asking a lot of questions. In fact, one of the biggest reason why companies fail their CE process, right, is because they are not presenting their clinical data properly, or they are not presenting their clinical data adequately, right? So CERs get rejected, or they get a lot of questions on that. They're not able to answer it. They're not able to give right data. And that's where, that to and fro after 3 times. So you only have 3 times to do the to and fro. If you're not able to crack by then, basically you see a rejection, right? So that's where, CE has gone very strict, right? Apart from few other things that they look into, but the clinical data aspect has been something that they have drastically improved upon from where they were versus where they are now. When you ask the question stringentness, right, with respect to what, right? Are you talking about with respect to review of documents? So if you say, let's say, with respect to the review of the submission, review of the dossier, right? If that's what the question is, right? Then I would say CE has improved drastically. FDA was always the benchmark, right? Because keep this in mind, sir, that the person who's reviewing your file in the FDA, right, let's say, is a PhD or a master's holder in that topic. So you can understand the kind of interaction that you're going to have with that kind of person, right? And there is not a one-person review panel, right? When even you go for your pre-submissions with the FDA, right? I have been in pre-submission with the FDA where I was with 3 people, and in the FDA had a team of 7 people, because one guy was an expert of cybersecurity, one guy was an expert of AI, one guy was an expert of the clinical claims that we were claiming, and 3 other were expert of human factors or whatever we had questions on, right? So that's the kind of involvement that they have. That's the kind of support that they have within their department, right? When you look at the European side of things, right, they have improved drastically, right? Their reviewers have also gone up a notch better compared to what it was, I would say, before MDR, right? So even they are asking a lot of questions. Very frequently, I have seen some of my submission where I have been questioned with a list of 30-40 questions, right? And all of those were legit good questions with respect to sample size, with respect to claims, with respect to discrepancies in documents, right? The way we were talking, the way we were presenting data. So all of those made a lot of sense, right? So the review quality of the European side of things have drastically improved, right? So what I would say is that when you are going for your C submission, the way it was before versus way it is now, it's huge difference, and you have to be prepared a notch better than what you would have assumed of C submission before, right? Another thing is when you talk about timelines, right? What has happened is there are only so many notified bodies in the world, and this is also very important for you guys to understand, right? Again, I'm going to point to Dr. Sonia on what she mentioned about these agencies which promise you things and things like that, right? There are only X number of companies in the world which are approved by the European Union, which can give you your CE certificate either under MDR or IVDR. The number of companies globally for IVDR is, I think, not even 20. Okay, globally. So you can imagine, right? And the number of companies globally for MDR is, I would say, around 30, 40, right? Still not a huge number. Before it was 100, 150, right? So now you can understand that these companies are already burdened with so much of work. So the existing products have to go from MDD to MDR transition. The new products are coming in. The whole healthcare industry is booming and coming up with new products and companies into the market, right? So the onus is on these 20, 30, 40 companies to give you the CE certificate. Now, naturally, the overall time to complete the whole process has gone very high, and the cost also has gone very high. So getting a CE certificate now is costly also and time consuming also. So with that thing in mind, many companies prefer to go towards FDA submission and maybe get an approval with FDA compared to getting it faster with respect to CE. That's a different thing altogether. But when you talk about review process, this is how the difference is. Right from you selecting your authorized representative to the person who's going to help you in your technical file, writing of your technical file, GSPRs, becomes very important, right? Even if your authorized representative is not good, and this happened with me, two different authorized representative, similar kind of product, two different companies. One selected an authorized representative which was expensive but a global name. Second selected authorized representative which was cheaper, someone who's working on its own from Germany. Okay, same product, same everything. I was the one who was working for both the companies, helping them out, right? One company got their approval within like 45 days, other took almost 4 months, right? So even the authorized representative that you are working with plays a very important role in building the credibility of the file that you are submitting, right? Or the review that you are doing, right? And that is also something you should keep in mind. So all of these aspects in the whole process of your getting your regulatory approvals are very important for you to keep in mind, right? You don't have to be too you don't have to get too bogged down with this, but just be aware, right? At least do your basic due diligence before you appoint your authorized representative, or before you appoint your your consultants also that you're going to work with. They do have fair understanding of the whole process. The thing about US FDA, right, that I really like a lot, right, personally, is the fact that they interact a lot with you, right? So they have programs of doing pre-subs. They have a lot of webinars. They have public forums where you can interact with them. Even if you missed out a webinar, I mean, there are webinars in public forum. You can do a pre-sub, right? Write it to them, give them your product details. In 60 to 90 days, they will tell you in a written feedback exactly telling you what you should do, what you should not do, answering your questions, and then you also get a chance to talk to them and get more insight, right? I think that's one thing that if I could advise CDSU, I would tell them that, see, if we can start this kind of program in India as well, helps companies a lot, right? Help them to clear their doubt, get them on track from day one, and you're directly, it's kind of a thing that where you're directly listening from the horse's mouth, so you don't have to have too much of confusion, right? Ye consultant ne wo bola, usne ye bola. You can avoid all that nonsense, right? So that's one really good thing that I like about FDA. FDA, the way they work is slightly different. They don't work on a, so again, everything starts from intended use, right? Everything starts from intended use, right? So they don't work with this concept where you need to look into rules and stuff, right? They have devices that they have identified. They have pre-classified devices. You look into your device. If your device has a predicate, the definition of predicate is basically any approved device which is similar to my device and approved by that country's regulatory body, and it's available in the market, is my predicate, right? So if I'm an ECG manufacturer, if there is an ECG in US which is approved and my claim and their claim are similar, then that becomes my predicate. If I want to sell in US and an ECG manufacturer has got an approval in India, they cannot be my predicate for the US application, right? Simple as that, right? And substantial equivalence is basically when you say that, hey, this is my predicate and whatever I am doing is similar to the predicate, right? From the testing, right? From the safety aspect, right? From the clinical studies, right? From biocompatibility, whatever is applicable to you, right? From your claims, whatever is applicable to you is similar, not same, to my predicate is substantial equivalence. Again, substantial equivalence does not mean that you need to be exactly same as your predicate. Even if there are differences, you need to highlight those differences to the FDA. You need to explain the FDA that, see FDA, this is the difference, but it is still not significantly different because my intent use is the same, my overall technology or the output is the same, the way I am doing things is similar, right? And even if there is minor difference in let's say he's using Bluetooth versus I'm not using Bluetooth, or he's using battery versus I'm not using battery, or he's using one type of a software, I'm using a different type of a software, you explain that difference, you explain how the difference has been verified, validated, and you have ensured that it does not have any additional safety concern. You do that and you move forward, right? So there is again a notion where people are replacing the word similar with same, right? Please don't do that, right? You can absolutely have differences. You will have differences in your product. Yeah, I mean, how can you make two same product? I mean, you'll have all sort of legal issues. No, after that, you will definitely have differences in your product, right? The intention of claiming someone to be predicate is not to say I am same as that person or I am same as that product, right? To say that I am similar with respect to certain aspect, you prove that, move forward, right? And that's where FDA becomes different in the way they do their whole regulatory approvals and stuff like that. Is that they look into the concept of predicates. If there is no predicate, what happens? If there is no predicate, then you can claim yourself to be the first of the kind, right? Or de novo, right? Again, a very straightforward, well-documented process. Again, the onus is again on you to submit all the right data, right from Safety and efficacy. It's not just safety, right? You can't just say that my device is safe, but it gives all sorts of false positive and false negative, and my efficacy is very low, right? Even that is something that FDA or any regulatory body will have objections, and they will not give you approvals, right? So both safety and efficacy becomes very important for you to ensure that you are meeting, you are ensuring this device is safe and it is also doing what you intended to do, right? Similar to ISO 13485, now FDA is talking about harmonizing 13485 with what they call as 21 CFR Part 820, which is FDA's equivalent to ISO 13485. They're trying to harmonize it and then kind of have a single, or rather accept ISO 13485 as well, which was not the case before. So similar to ISO 13485, FDA has its own quality management system, which they call it as QSR, Quality System Regulation, which is 21 CFR Part 820, right? And then there are similar other parts 803, 801, which will be applicable to you, based on what product you are making. Apart from the ISO and IEC standards, you should also be mindful of all the guidances that European guys have also followed or developed, which is called MDCGs, right? And the FDA has also developed, right? FDA has bunch of guidance document. They have guidance document on software. They have guidance document on AI. They have guidance document on human factors. They have guidance document even on if you have developed a blood glucose monitoring system for, let's say, self-use versus for, let's say, hospital care. They have two different guidance documents for both the application, right? And the actual clinical study that you do for both for two different kind of application is also different. So it's the onus is on you to find the right guidance document for you. It's all there. You need to be aware of what your product is. You need to do your research. You need to ensure that you have your regulatory strategy, ironed out, and then implement accordingly, right? If you know, right, how to go about it, I can tell you it's not that difficult, right? It is only things become difficult is because either you don't know or you don't know where to look for. अगर मेरे को पता ही नहीं है करना क्या है, then it becomes very difficult. और मुझे अगर ये भी नहीं पता कि जाके देखूं कहाँ पे, then also it becomes very difficult. So if you don't know, and even if you don't know where to look for, both these things will make your life difficult, right? And that's where I see a lot of issues with respect to regulatory side of things, because people they typically talk to other people and they get confused because one person will say something else, other will say something else, and they are like, oh, where do I even go and start from, right? So to avoid those things, if you know your product, you do your research right, you look at the right places, your strategies can be ironed out pretty well. One more thing that I would like to highlight is many times, people come to me and they say, oh, my product is ISO 13485 certified. Your products are never ISO 13485 certified. It is your company. It is company XYZ, company ECQ Solutions, which will get their ISO 13485 certified. And it is the product which undergo regulatory approval. So every product that your company might have manufactured will have its own regulatory approval. If you have 10 products, all 10 products will have to have their own regulatory approval, and all 10 products might have their different classification, right? One might be A, B, C, D, whatever it might be, right? So please keep that also in mind, right? You never say that my product is ISO 13485 certified. It is your company, right? And once your company is ISO 13485 certified, as I said, it's your culture now, right? So you need to ensure that everything that comes out of that company is following the right process that it needs to follow, document, do everything that you need to do, build the DHFs, build the DMR, build the DHRs where applicable, and ensure that you are maintaining those, within your organization, right? One more thing, just because my product is class A in Europe, it doesn't mean that it's going to be class 1 in the US. I'll give you an example. Whole slide imaging system in the world of digital pathology, right, is class A in Europe. For me to get approval for a whole slide imaging system in Europe is like very simple. It's class A process is very simple. Guess what? The same whole slide imaging system in the US is class 2. Not only that, with special controls. What does that mean? The kind of clinical study that you have to do for a whole slide imaging system, the kind of in-house testing that you need to do for a whole slide imaging system is rigorous, right? You need to do inter-pathologist variation study. You need to do inter-site study. You need to do intra-system studies and clinical studies, right? That too, minimum 1200 cases, right? So please don't be in this notion that, oh, you know what, mera device India mein class A, so life is sorted, right? No. Every country, as I started from my first slide, every country has its own regulations. Every country has its own way of looking at things. You need to understand that. You need to ensure that. You need to develop a regulatory plan against that, and then you need to execute, right? So please do not assume things, right? Ensure that you verify, ensure that you document it, and then you implement it. One thing that I want to highlight in this discussion is over the last 1 year that I have seen a lot of discussion happening is something called breakthrough designation, right? We are talking about novel technologies, we are talking about novel healthcare. If you believe you are doing something which is unique, which nobody has done, please apply for breakthrough designation, right? This is something that FDA officially grants you a designation called breakthrough designation, helps you in your development, helps you in your overall approval process. This does not mean that you have got an approval to sell, right? Please keep that in mind. This just gives you a formal designation that what you're doing is indeed novel, and based on that, FDA will support you. This is again with only with FDA. No other country has this kind of a program. Only with FDA, and you can leverage it to build your credibility, your product's credibility, your company's credibility, all of that, and then it also helps you in your overall approval as well, right? Last 2 3 slides, way forward. So what's happening, right? We are almost entering in a world pretty much that everything and anything you want to do, AI is going to be part of it, right? So when AI becomes part of of our life in such a in such a close manner, right? A lot of work happening at the AI side of things, right? And when you talk about AI, the one thing that automatically comes into the picture is cybersecurity, right? Please ensure that if you are a company which is dealing with software, if you are a company which is dealing with processing data, if you're a company which is dealing with AI or using data, right, for your AI, you have good cybersecurity framework in place, right? 27001 is a good place to start with, but this is not the only way, right? Your testing protocols, your documentation, your processes, both FDA and CE, MDCG has very good guidelines on how to go about your cybersecurity, how the processes should be defined, what kind of documentation you need to maintain, what kind of testing you need to do. Please have a look at that, right? When you talk about AI predominantly talks about how you deal with data. Your data becomes the key. You're using that data. Traceability of that data becomes very important, right? If I have to highlight something from an AI side of things, right? How are you ensuring the data sets that you're using, the training and testing data set for developing the model? How do you ensure the traceability of all of that, right? So please ensure you have those within your organization. You have developed the process around it, you have control around it, right? So AI and cybersecurity, day by day I see new standards coming in, new guidance is coming in, right? Recently the FDA launched a guidance for AI practices and documentation you need to submit if your product is an AI product. Have a look at that as well. Finally, few things for startups. Start early. I think every one of us has been telling this from since morning, day one. Start early, start early, start early. I think I personally have lived that, right? I've seen situations where we did not start early, and what all we had to do, when we reached a certain stage, right? So you'll be more efficient. You'll save a lot of money and time if you start early, right? Have some predefined goals. Try to tell yourself that okay, 21 CFR pari 21 3 4 8 5, कुछ तो दिमाग में रखे, start building your documentation, right? Don't be blank, right? It's okay for you to not even apply for certification if you don't have the funds, right? But at least within your organization start having that culture, right? Define your quality and regulatory strategies properly. Keep another thing in mind that QMS and regulatory is not there is like no single way in which you can get it done, right? I can build a QMS system which can have hundreds of documents, hundred of processes. I can build a QMS system for the same company with limited number of documents and practices and processes, right? So don't jump around. Stick to your strategy. Stick to your guide. Whoever is guiding you, mentoring you, consulting you, right? Stick with them. Look into their strategy, understand their strategy, see what strategy best suits you. There are 10 different ways in which you can get your approvals. There are 10 different ways in which you can get your company ISO certified. As far as you're doing it the right way with the right people, you should be good to go, right? So don't overthink your QMS and regulatory strategy, but then don't underthink also, right? Try to be balanced, right? Companies which try to overthink, they tend to do a lot of more things, and that also causes a lot of issue from commercialization perspective. And the ones which are not at all thinking are also creating a lot of issues for themselves, right? So try to balance it out. As I said, it should be part of your strategy, your company strategy, your product strategy, and if you can do that, you will be much more efficient in your outputs, right? With this, I would like to conclude. Thank you so much.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
Hello, good morning everyone. I'm Vijan Adiminti. I'm CEO and Director of AgHub, Agri Innovation Hub of Professor Jayashankar, Telangana's Agriculture University. AgHub is an incubation center which is in the mission of promoting agri-tech startups, student companies, and rural companies. AgHub is a first of its kind model in an innovation hub at Hyderabad in Telangana, promoting startups and student companies across India and Telangana. We also have India's first rural innovation spokes, the dedicated rural incubation centers as a part of AgHub in the state of Telangana. These rural innovation spokes are spread across as agri incubators, food processing incubators, skilling incubators, and community innovation centers, which are funded by NABARD, Ministry of Food Processing, MSME, and Niti Aayog. The rural incubation centers are housed in northern Telangana in a place called Jagatyal, central Telangana in a place called Warangal, and Tandur in the southern Telangana. These rural incubation centers, three agri incubation centers, have been promoting agri based enterprises among youth, women, farmers, SHGs, FPOs. We also have food processing incubators which are trying to promote mango and paddy food processing in Jagatyal, northern Telangana, spices food processing in Warangal, central Telangana, millets and oil seeds and safflower, tandoor dal, tuar dal or pigeon pea processing in southern Telangana. We also have a skilling center for promotion of skilling in the tandoor dal and safflower oil in the Tandur, southern Telangana. We also are going to come up with Atal Community Innovation Center by Niti Aayog in Jagatyal, which is primarily to promote skill and innovations among rural youth in aspirational districts of northern Telangana. This Ag Hub, a first of its kind effort in a hub and spoke model, the last 4 years has been able to nurture almost 150 plus food and agri-tech startups across various programs. Ag Hub also, apart from its very unique India's first rural innovation spokes, has also been India's first in launching India's first co-innovation program. It is a very unique program to co-create innovations between startups and scientists of the university. AgHub has also launched India's first Agri Innovation Pilot Program, which is a program to validate agri-tech startup technologies. AgHub has also been pioneering in promoting student entrepreneurship through first of its kind design thinking programs in agriculture for young agriculture graduates, postgraduates, and management professionals. Apart from promoting 150 food and agri-tech startups, AgHub has been able to run 7 design thinking programs, nurture more than 3,800 graduates and postgraduates in design thinking, create a pool of ideas, more than 750 ideas under Idea Sprout, and build 8 student companies. And AgHub, with its ongoing rural incubation centers, has been nurturing more than 15 rural enterprises in the last 1.5 years. The AgHub rural incubation centers in Jagatyal and Tandur have been recently inaugurated, and the Warangal incubation center in central Telangana is going to be inaugurated very soon. The AgHub is in a mission of creating a pool of innovations, a pool of ideas, a pool of early stage startups from the startup founders, students, and rural innovators and entrepreneurs. AgHub is a model which is trying to connect the startups and innovations to the farming community. Today, I'm here to talk about the Agri-Tech Market Access Program, a very unique program to connect startups and innovations to the farming community. This is a very unique program where the startups incubated at AgHub, the startups which have piloted their technologies in the validation programs, the startups which have co-created their technologies under the co-innovation programs, and student companies which have created their innovations under their programs, and last but not the least, the rural innovators and entrepreneurs which have created various unique innovations and products for the farming community. All of these technologies are being showcased. Few select technologies are being showcased to the farming community. This Agri-Tech Market Access Program aims to connect promising innovations, technologies, products, and services to the farming community for bettering agriculture and for bettering farming community. This program, Agri-Tech Market Access Program, funded by the Caspian Impact Investments CSR initiative, is a very unique program to connect the startups to the last mile and farms. On this eve, I would like to thank our donor, Caspian Impact Investors Private Limited, for its earnest support under its CSR initiative for this very unique Agri-Tech Market Access Program and helping create an opportunity to connect the Agri-Tech startup founders to more than 250 farmers in both Warangal through our Rural Incubation Center at Warangal and the Jagatyal, Northern Telangana, both of these, and connect these promising innovations to the farming community. Thank you one and all the university staff and the scientists, the farmers, agribusiness fraternity, and the startup founders, along with Caspian Impact investors, to have come together in creating and unleashing the potential of agri-tech market access program, what we call as AgMap, to benefit both startups and the farming community. Thank you, one and all. Let's hope that agriculture gets better, agriculture gets digital through such initiatives. Thank you.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
అందరికీ నమస్కారం. నా పేరు విజయన్ అడిమిటి. నేను యాగ్ హబ్ అనే ఒక అంకుర సంస్థల యొక్క ఇంక్యుబేషన్ సెంటర్ యొక్క సిఇఓని. యాగ్ హబ్, అగ్రి ఇన్నోవేషన్ హబ్ అనే ఈ అంకుర సంస్థల ప్రోత్సాహన కల్పించే ఈ ఇంక్యుబేషన్ సెంటర్ ప్రొఫెసర్ జయశంకర్ వ్యవసాయ విశ్వవిద్యాలయం ద్వారా స్థాపించబడింది. 2020 నుంచి యాగ్ హబ్ అనే ఈ ఇంక్యుబేషన్ సెంటర్ అంకుర సంస్థలు, స్టార్టప్స్, స్టూడెంట్ యొక్క అంకుర సంస్థలు మరియు గ్రామీణ అంకుర సంస్థల కల్పన కోసం, వాటి ప్రోత్సాహకం కోసం స్థాపించబడింది. ఈ యాగ్ హబ్ అనే ఇంక్యుబేషన్ సెంటర్ని నాబార్డ్, మినిస్ట్రీ ఆఫ్ ఫుడ్ ప్రాసెసింగ్, ఎంఎస్ఎంఈ, చాలా గవర్నమెంట్ ఆఫ్ ఇండియా ఇన్స్టిట్యూషన్ సపోర్ట్ చేయడం జరిగింది. ఈ యాగ్ హబ్ యొక్క కార్యకలాపాలు హైదరాబాద్లో ప్రొఫెసర్ జయశంకర్ వ్యవసాయ విశ్వవిద్యాలయంలో అంకుర సంస్థలు తెలంగాణ నుంచి మరియు భారతదేశంలో ఉన్న అన్ని అంకుర సంస్థలకి లాభం పొందే విధంగా వాళ్ళకి సపోర్ట్ చేయడం జరుగుతుంది. యాగ్ హబ్ దీంతో పాటు మొదటిసారిగా గ్రామీణ ఆవిష్కరణ కేంద్రాలు అనగా రూరల్ ఇన్నోవేషన్ స్పోక్స్ ని స్థాపించడం జరుగుతుంది. ఈ గ్రామీణ ఆవిష్కరణ కేంద్రాలు, రూరల్ ఇన్నోవేషన్ స్పోక్స్ తెలంగాణలో జగిత్యాల్, వరంగల్, తాండూర్ లో ఇవి స్థాపించబడ్డాయి. ఈ గ్రామీణ ఆవిష్కరణ కేంద్రాలు మూల లక్ష్యం గ్రామీణ అంకుర సంస్థల ప్రోత్సాహకం కోసం చేయబడింది. గత 4.5 సంవత్సరాల్లో యాగ్ హబ్ సుమారుగా 150 డిజిటల్ అగ్రికల్చర్ క్షేత్రంలో ఇన్నోవేషన్స్, స్టార్టప్స్ మరియు టెక్నాలజీస్ ని సపోర్ట్ చేయడం జరుగుతుంది. యాగ్ హబ్ యొక్క సంకల్పం వల్ల వినూత్నమైన కొత్త టెక్నాలజీస్ వ్యవసాయ క్షేత్రంలో రైతులకి మరియు అగ్రి బిజినెస్ కి అందుబాటు తేవడం కోసం ఈ ప్రయత్నం జరుగుతుంది. ఈ 4 ఏళ్లలో ఈ 150 ఇన్నోవేషన్స్ వ్యవసాయం మరియు వ్యవసాయ ఆధారిత క్షేత్రాలలో కూడా ఈ ఇన్నోవేషన్స్ ని తీసుకురావడం జరుగుతుంది. ఈ యాగ్ హబ్ యొక్క సంకల్పం ఏంటంటే, వ్యవసాయం మరియు వాతావరణంలో వచ్చే మార్పులు మేము దాన్ని అధిగమించడానికి కోసం ఇలాంటి వినూత్నమైన స్టార్టప్స్ ని ఐడెంటిఫై చేసి వాటికి సైంటిస్ట్ యొక్క సలహాలు, సూచనలు, అలాగే ఇండస్ట్రీ యొక్క సలహాలు, సూచనలు జోడించి ఆ ఇన్నోవేషన్స్ ని వ్యవసాయ క్షేత్రంలో రైతులకి మరియు వ్యవసాయ ఆధారిత బిజినెస్లకి అందుబాటులో తీసుకురావడానికి అగ్రి హబ్ పాటుపడుతుంది. ఇలాగే కాకుండా అగ్రి హబ్ ఇవాళ ఉన్న ప్రాంతంలో అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ అనే ఒక కొత్త ప్రోగ్రామ్ ని నడుపుతుంది. ఈ అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ యొక్క మూల ఉద్దేశం ఏంటంటే, కొత్త టెక్నాలజీస్ ఈ అంకుర సంస్థలు రైతులకి మరియు ఎఫ్పిఓలకి పరిచయం చేయడం. ఇవాళ అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్, యాగ్మ్యాప్ ప్రోగ్రామ్ అనే ఈ ప్రోగ్రామ్ ని కాస్పియన్ ఇంపాక్ట్ ఇన్వెస్టర్స్ ప్రైవేట్ లిమిటెడ్ అనే ఒక సంస్థ వాటి యొక్క కార్పొరేట్ సోషల్ రెస్పాన్సిబిలిటీ సిఎస్ఆర్ ఫండింగ్ ద్వారా సపోర్ట్ చేయడం జరిగింది. ఈ అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ ద్వారా సుమారుగా 7 ఇన్నోవేషన్స్, స్టార్టప్స్, అంకుర సంస్థలు మరియు గ్రామీణ ఆవిష్కర్తల యొక్క ఇన్నోవేషన్స్ ని, ప్రొడక్ట్స్ ని, టెక్నాలజీస్ ని మరియు సర్వీసెస్ ని రైతులకి, ఎఫ్పిఓస్ కి పరిచయం చేయడం కోసం ఈ ప్రోగ్రామ్ ని మేము రూపొందించాం. ఈ ప్రోగ్రామ్ వరంగల్ మరియు జగిత్యాల్లో మేము సుమారుగా 250 రైతులకి, ఎఫ్పిఓస్ కి, ఎఫ్పిఓ లీడర్స్ కి ఈ 7 గ్రామీణ ఆవిష్కర్తలు మరియు స్టార్టప్లని పరిచయం చేస్తున్నాం. ఈ ఇన్నోవేషన్స్ మా పరంగా వ్యవసాయానికి మరియు వాతావరణ మార్పులు మరియు వ్యవసాయ ఆధారిత బిజినెస్లని సపోర్ట్ చేయడం కోసం పనికొస్తాయి. యాగ్ హబ్ యొక్క సంకల్పం ఇన్నోవేషన్స్, అంకుర సంస్థలు, స్టార్టప్స్ ప్రోత్సాహకం కాదు, ఇలాంటి ఇన్నోవేషన్స్ రైతులకు అందుబాటులో తేవడానికి ఈ గ్రామీణ ఆవిష్కరణ కేంద్రాలు అంటే మా యాగ్ హబ్ యొక్క రూరల్ ఇన్నోవేషన్ సెంటర్స్ రూరల్ ఇన్నోవేషన్ స్పోక్స్ ద్వారా ఈ ఇన్నోవేషన్స్ ని రైతుల ద్వారా తీసుకెళ్ళడం. ఈ ఇన్నోవేషన్స్ రైతుల ద్వారా తీసుకెళ్లే ఈ కార్యక్రమంలో మేము యాగ్ హబ్ యొక్క అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ ని సంకల్పించడం జరిగింది. ఇవాళ చాలా సంతోషంగా ఉంది. అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ ద్వారా ఇలాంటి వినూత్నమైన స్టార్టప్స్ మరియు ఇన్నోవేషన్స్ ని మేము రైతులకు అందించాము. చాలా మంచి స్పందన వస్తుంది. రైతులు ఇలాంటి ప్రోగ్రామ్ చాలా కొత్తగా ఉంది. ఎన్నో ఏళ్ల నుంచి మేము ఇలాంటి ట్రైనింగ్ ప్రోగ్రామ్స్ వింటున్నాం. కానీ ఈ ఉన్న ట్రైనింగ్ ప్రోగ్రామ్స్ ఇలాంటి డిజిటల్ అగ్రికల్చర్ క్షేత్రంలో ఇలాంటి ఇన్నోవేషన్స్ మరియు స్టార్టప్స్ వినడం మాకు ఇదే మొదలు. చాలా కొత్తగా ఉన్నాయి, వ్యవసాయానికి కొత్త కొత్త మార్పులు వస్తున్నాయి. డ్రోన్ యొక్క టెక్నాలజీస్, అలాగే ప్యాడీ ట్రాన్స్ప్లాంటర్స్, పౌల్ట్రీ రేకింగ్ మెషిన్స్ అనండి, లేకపోతే ఇలాంటివి అగ్రో ఫోటోవోల్టాయిక్స్, సౌరశక్తిని మనం ఎలా వ్యవసాయంలో వాడుకోవాలి, అలాగే మనం రోబోటిక్ వీడర్స్, అలాంటి కొత్త కొత్త మెషిన్స్, అలాంటి కొత్త కొత్త టెక్నాలజీస్ ని చూసి రైతులు, గ్రామీణ మహిళలు మరియు ఎఫ్పిఓ లీడర్స్ చాలా ఔత్సాహికంగా, చాలా శ్రద్ధగా విన్నారు. చాలా శ్రద్ధగా వాళ్ళు విని ఇది వ్యవసాయానికి చాలా కొత్త మార్పు, వ్యవసాయం అనేది అగ్రికల్చరే కాకుండా, రీసెర్చ్ బేస్డ్ అగ్రికల్చరే కాకుండా ఇది ఒక డిజిటల్ అగ్రికల్చర్ పరిణామంగా చెందుతుంది. ఎలాగైతే మొబైల్ ఫోన్ అనే ఒక టెక్నాలజీ అందరు అందుబాటులో వచ్చిందో, రైతులు మరియు సైంటిస్టులు, ఇక్కడ వచ్చిన శాస్త్రవేత్తలు అందరూ అదే అభిప్రాయపడ్డారు. ఇలాంటి అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్స్ ఇంకా జరగాలి. ఇలాంటి ప్రోగ్రామ్స్ ద్వారా మరియు యాగబ్ యొక్క సంకల్పం ద్వారా ఇలాంటి అంకుర సంస్థలు, స్టార్టప్స్, ఇన్నోవేషన్స్, ఇలాంటి అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ ద్వారా రైతుల్లో అందుబాటుకు వస్తే రైతుల్లో కొత్త కొత్త ఆలోచన విధానాలు, రైతుల్లో ఉన్న సమస్యలను అధిగమించడానికి ఇలాంటి ప్రోగ్రామ్స్ బాగా తోడ్పడతాయని అందరూ అభిప్రాయపడ్డారు. ఈ ప్రోగ్రామ్ కి మాకు మళ్ళీ ఈ అవకాశం ఇచ్చిన ఈ కాస్పియన్ ఇంపాక్ట్ ఇన్వెస్టర్స్ కి మాకు అవకాశం ఇచ్చి యాగబ్ కి ఇలాంటి అగ్రిటెక్ మార్కెట్ యాక్సెస్ ప్రోగ్రామ్ కండక్ట్ చేసి రైతులని ఎఫ్పిఓస్ కి కనెక్ట్ చేసి, స్టార్టప్స్ ని ఎఫ్పిఓస్ కి కనెక్ట్ చేసే ఈ అవకాశం ఇచ్చినందుకు కాస్పియన్ ఇంపాక్ట్ ఇన్వెస్టర్స్ కి మా కృతజ్ఞతలు. మరియు మా డోనర్స్ నాబార్డ్, మినిస్ట్రీ ఆఫ్ ఫుడ్ ప్రాసెసింగ్, ఎంఎస్ఎంఈ అండ్ గవర్నమెంట్ ఆఫ్ తెలంగాణకి మా కృతజ్ఞతలు.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
Welcome to all of you to CCMB and for this workshop. Thank you, Ramji, for asking me to speak for a while about guidelines, novel healthcare solutions. Not really my topic, but nevertheless. I'll just give a brief, very brief background of what CCMB is all about. And we actually kind of started off almost 37 years ago in 1977. And at a later point of time, we started off in this building across in 1987 on November 26th. Since then, it has expanded. Now we have quarters which are located a little bit nearby, but a separate campus. And then we also have CRF, that is where AIC is currently located. And we have Lacons, which is a bit far away. And we also have acquired around 48 acres of land in the last 2 years ago. In total, we have around 70-80 acres of land across Hyderabad. And we are going to be part of Bio E3 policy that is happening, and where Telangana is planning to set up a new place, and we will be working along with other institutes to be part of that. And we are also going to contribute in that context in one area so that it can be beneficial for biomanufacturing in India. These are some of the things that we actually this is the background. And as an institute, from the start, the emphasis was on doing high quality basic research, which is cutting edge, and there has to be some level of societal benefit. And in that context, in 1988 itself, the first impact was made, where the DNA fingerprinting was actually started in CCMB by Dr. Lalji Singh. And at a later point of time, we went on to develop wildlife diagnostics. That is what has led to Lacons. And wildlife diagnostics is important because we test around 300 samples, variously, mostly coming from forest department and other things related to sensitive matters like poaching. And then we also have started diagnostics per se. So the diagnostics specifically focused on rare genetic diseases is basically something which is we do it as both as a societal work also, because it's an area where not many people are present, and we are kind of the referral lab for many government places. And then we have these are some of the things that we have started. And in addition to that, Lacons has very strong work on all the way from snake venoms to centipedes and the evolution. biodiversity and finding out metabolomes and literally finding out whether that has any particular thing to prediction for pregnancy of animals, and lots of other aspects. So as an institute, I mean, in addition to this, we were involved in this coming up with improved for Samba Masuri rice, coming up with a diagnostic which is recently approved for sickle cell anemia, both confirmatory as well as, I mean, detection as well as confirmatory. That is by Dr. Chandak, who's sitting there. And basically, some of these other aspects have been done. mRNA vaccine, we were the ones to kind of do it first. So there are lots of other work that we have done over a period of time, both in animal thing and this. In 2017, I think Dr. Rakesh Mishra has taken the plunge to get into incubation arena. And that's how the Atal Incubation Center has started. And you can very clearly see that particular efforts have gone quite well. In the last 7 years, they have incubated around 150 different incubators have gone through the place. And if you go there, the place is literally, I mean, one of the pretty well equipped. And also they have access to all the CCMB facilities. So in one sense, we have reasonable ecosystem. However, can it be improved? Yes, it can be improved. We'll work on that, whatever needs to be done. With the Bio-E3 policy coming in, and we kind of have to work in a way that we leverage our strengths in AIC, and all the startups should be using this in a way to kind of establish themselves in more biomanufacturing area. It's a step in the right direction. So that's one thing. If we don't use it, it's our fault. But that is an opportunity for all of us. I mean, our contribution was very significant during the pandemic, where we were, CCMB was one of the first institutes in India to start the testing, and in fact, even teach many other people across the board. And in the process, we helped test medical devices, and we even evaluated various other testing, kits. We were one of the kids, one of the people who are involved in certifying things at that point of time. So that's why, in case of when you start now talking about novel healthcare solution, I believe it's an holistic thing. Regulatory aspects of, with respect to approvals and how do we go about it is a black box for many. And if you were to ask me, even I do not know the complete details, but certainly a big black box. For students and all, it's like something like that they really don't care to remember, nor do they want to, because their research per se does not involve the regulatory landscape, knowing about regulatory landscape. And this becomes more, if you have the ambitions to be an entrepreneur, you actually have to understand the regulatory landscape of India. And it has its own hoops. And but there is a lot of effort from the government, especially DCGA and all, to make this regulatory aspects a little more, I would say more friendly to the stakeholders. And so this is an aspect, I think it's a step in the right direction to have a discussion on this, a workshop on this, to make people aware of the regulatory landscape and guidelines, how one can do it, and how we can actually look into healthcare, come up with healthcare solution. There are multiple things. One, you come up with solution in terms of kits, and then you have a reasonable number of hoops to take care of. Or if you are having a medical device, and it's a different set of hoops. But nevertheless, this is something we need to really know if we want to go forward and, be a part of, if your technology slash kit slash the method or the equipment that you developed has to be part of the mainstream, one has to understand this landscape, right? And the aspect that I want to touch upon is this is actually a scenario that is sponsored by BFI Biome, and we have a close working relation at both at the institutional level and at the AIC level with BFI Biome. And we kind of set up partnership with BFI Biome. There are 3 projects at CCMB that are supported by BFI Biome, and it's like we kind of gave 6 projects, and they had their own internal review to come up with 3 projects, and eventually those 3 projects are going on. This is a 2-year thing, but it's something which is, I would say that they're also supporting other places because of other CSR institute like CDRI, and I think CCMB relation with BFI became the template for how CDRI is going to execute it. So this is an aspect where I believe this collaboration is kind of, I would say, in its first year, and it's something that we hope will give something useful to the community at a research level, as well as its interactions, and this thing with the AIC would end up giving us something useful. And we have always kind of worked closely with BIRAC, CIDESCO, and other CROs. This is something that we have. AIC CCMB specifically has worked closely with many of these things. BIRAC is something that I kind of know when it started off, because I was part of National Institute of Immunology prior to this. And at that time, Dr. Ban was talking about BIRAC, and I was a very young scientist. I was 3 or 4 years into NII at that time. There was a huge talk about BIRAC, and it was like something that I didn't understand very well at that time. And but the man is a visionary. He started BIRAC, and you can see that his vision has paid off in a big way. And BIRAC has, in fact, supported so many startups. And in fact, one of the BIRAC's, BioNest is actually there in Delhi University, and which is run by my better half. So there are, kind of had an association in many ways with BIRAC as a reviewer, as this, as that, and even had one BIRAC project as an investigator, that too with your current secretary. So CIDESCO and CROs and other regulatory agencies, being here today, actually talking about this particular scenario, because it would actually help our students and all the entrepreneurs who are around here understand the landscape. More than anything else, I'm telling you, landscape is not something people are aware of. I'm telling you, even I'm not very comfortable with knowing the, I know I would say overall, it's almost like knowing alphabets, but not the words. So we need to understand this, and I think stakeholders need to understand all the more. And so I would appreciate, I appreciate the thought, and I appreciate the fact that we are doing this. And I would say all the best for the workshop. With this opening remarks, I want to let experts take over and talk about what this landscape is really about, and what kind of guidelines are there for the novel healthcare solutions. Thank you.
To stay informed about the startup ecosystem, subscribe to MyStartupTV.
నా పేరు వివేకవర్ధిని. అయితే మేము మిట్పల్లి ఎఫ్ఈఓ నుండి ఇక్కడికి పులాస అగ్రి హబ్ దగ్గరికి వచ్చాము. అయితే ఇక్కడ మేము అందరం కలిసి స్టార్టప్ కంపెనీలతోని టైఅప్ అవ్వడం ఎలాగూ, మరియు రైతులు అధునాతనంగా ఇక్కడ కొన్ని కంపెనీలతోని మిషన్స్, ఇన్నోవేషన్స్ చూపించడం జరిగింది. రైతులకు వీటిని మేము అక్కడ ఎక్స్ప్లెయిన్ చేసి వారితోని ఇంకా ఈ వరిలో కలుపు మొక్కలు తీయడం కానీ, వరిలో దుక్కిలో కలుపు మొక్కలని ఏర్వేసే మిషన్ల గురించి కానీ, కోతుల బెడద నుంచి సోలారు పెన్షనింగ్ కానీ అవన్నీ చూడడం జరిగింది. అవి ఎంతో ఉపయోగకరంగా ఉంటాయి. అయితే ఒక రైతు తీసుకోవడం అది ఎంతో కష్టం, కానీ ఎఫ్ఈఓ ద్వారా కొనుగోలు చేసి వాటిని రైతులకు అందించి మరింత రైతుల పురోగభివృద్ధికి దోహదం చేసే విషయాలను, చాలా విషయాలు 3 గంటలలో చెప్పడం జరిగింది. ఇది మాకు కానీ రైతులకు కానీ ఎంతో ఉపయోగపడుతుందని అనుకుంటున్నాను.
To stay informed about the startup ecosystem, subscribe to MyStartupTV.
Hi, my name is Akshay. I'm a founder and CEO of Studivity, and this startup is, the mission is to create a movie with an AI. Okay, and with this help, around hundreds of thousands of filmmakers are using our platform to streamline their pre-planning and pre-production journey. Think of it, currently, many people are generating Ghibli. Okay, But if you get the sequence of all those storyboarding, how would it look like? Then it would easier for the creators to pitch their concept for the directors, producers, arrange the finance, and create a blockbuster movies, web series, and all. And yeah, and this I came here in the Mahapum. Okay, we are incubated by IM Kasipur. I am from IIT Roorkee itself, and this is the innovations that we bring it to the world. And currently, we are the leading player in this industry. Mahakumbh has given me an immense pleasure to connect with other people, startup investors, those who come to our pod, and we have also built many connections. Some of them are also foreigners, those who visited our pod and they are really interested in our startup. So yeah, it's a wonderful journey being here, and I feel lots of entrepreneurs have to visit here for the networking, and they also find lots of colleagues here. So thank you so much. I feel like our young generation is very passionate about driving things, education. India have the power. India is an IT hub, so they have a talent, resources, each and everything. Just they want a direction, mentorship support, and a financial aid. So it will really helping them with this environment, and what government, Indian government is doing. So yeah, I feel like yeah, that's all. And thank you My Startup TV for featuring our startup and coming here. It's my pleasure.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
So myself Ankit Agarwal, I am representing Samaj.ai. We are into video analytics, as you can see. So we have a large customer base, and we are primarily solving out the problems for national highways authority of India. So in terms of, you can see the client base presently we are catering, that is national highways, the tunnel division, the enterprise security, and this, as you can see, we are detecting the number plate of the vehicles with the speed and getting the challans. We are thankful for the government to help us give the opportunity to start to exhibit our showcase event.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
Ankur Dhanuka. I am a founder of Keen Edge Technologies. We are a Bangalore-based AI product studio. At the moment, we have 7 product exposures in areas like construction, tech, education, HR, learning and development. And I am at the Startup Mahakumbh 2nd edition 2025 to explore what AI world has to offer. And I'm seeing folks over here making so many things in AI, forming collaborations. Absolutely, I see a lot of fast moving trends happening, especially in the Indian ecosystem. We are a developer community out here in India, and which will make for the world. So, for example, we are making one of the use cases as niche LLMs for the education sector. So, people who are developing, they need to actually take this long shot as well, not just make something in 3 to 4 days and call themselves as product. We need to think big. That's how the Indian ecosystem will start to impact the world. And at the same time, a message to all folks in my ecosystem, my fellow founders or developers: distribution is going to be the moat. So you need to look at distribution, not just the building part of it. And guys, speed is the killer over here. If you are not up to speed, you will become a dinosaur very soon. That's my message.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
Hi, my name is Bhavesh Kothari. I am the Chief Executive Officer of MSSU iSpark Foundation, Section 8 company by Ratan Tata Master State Skills University, supported by MSINS. We have around 40 odd startups that we have incubated over the past 6-7 months. And out of that, we have been able to bring around 15 startups to the Startup Mahakumbh 2025. I think this is truly a Mahakumbh in its sense, because कुंभ के मेले में आप खो जाते हो, वैसे यहाँ पे स्टार्टअप महाकुंभ में आप खो जाओगे. इतना इनोवेशन है, इतना पैशन है, इतना एनर्जी है. One of the beautiful parts about the Startup Mahakumbh is that there is a 40% representation of women-led founded startups, जो कि एक अपने आप में एक बहुत बड़ी बात है. With the kind of energy for the past 3 days, the kind of engagement for the past 3 days, I think it's phenomenal. ये सच में ये एक महाकुंभ है, and we are hoping that this is going to go much more larger, much more bigger, and where we will have global startups coming here and engaging with the local startup community. I think ये एक बहुत बड़ी community बन जाएगी. And kudos to our Honorable Prime Minister Shri Narendra Modi ji, kudos to Shri Piyush Goyal ji, kudos to DPIIT and Secretary and Joint Secretary sir, and to the entire organizing team of DPIIT. Special thanks to Mamta Venkatesh ji from Axel for helping us bring around 15 startups from our cohort to this particular Mahakumbh and culminate and help them nurture and grow. I think one last message to all the entrepreneurs: keep hustling, keep innovating, and make sure that you make India a proud country and take it to the global level. So all the very best, and look forward to again meeting you at Startup Mahakumbh 2026. Thank you so much.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
We have, about $680 billion to support the startups. So we would love to attract India startups to come to Korea. Startup Mahakumbh was really great choice of our government.
Hello, welcome to MyStartupTV. I'm Major Sunil Shetty. We are here at Startup Mahakumbh. We are at Bharat Mandapam, and I have my special guest with me, Crystal, who is the manager for Global Partnership Team. Crystal, thanks for talking to MyStartupTV.
Nice to meet you. I'm Crystal Lee. I came from Korean government agency, specialized for the startup support.
So, Crystal, let's start by understanding, about startup ecosystem in Korea.
Okay, yeah, South Korea is not, I know it is very popular in terms of the culture, but startup is also very strong in South Korea. We have fast growing ecosystem now, and Korean government is leading that ecosystem with lot of cooperation partners. So we have, about $680 billion to support the startups. That is the huge budget for the startups, and among that kind of support, we have the Ministry of SMEs and Startups. That is the major ministry to help the startup